TTA stands for tibial tuberosity advancement. That's a surgical procedure to repair torn cruciate ligaments in dogs. The torn cruciate ligament is the leading cause of lameness in the rear limb of a dog. There's a pair of crossing ligaments inside the knee, and they stabilize the knee to keep it from moving back and forth like this, so that when the dog stands, the leg stays stable. So we've got this model here. The cruciate ligament prevents that from happening. In this model, I can advance it because I've got a torn ligament in there. And when the dog stands, this bone wants to fall off the back side of this bone, like that. And the cruciate ligament prevents that from happening. So the goal of the surgery is to provide stabilization of the knee joint so that the dog can stand, walk, and run effectively. I've been doing cruciate repair surgery for a number of years and have performed hundreds of those kinds of surgeries in general, but I've been performing the TTA surgery now for over 4 years and have performed hundreds of those, and just totally delighted by this procedure. In fact, from my point of view, from a professional point of view, this one procedure is the most satisfying thing I do right now as a professional because of the tremendous success that we're having with it. Prior to surgery, we take an x-ray so that I can determine how much I need to move this bone. This is the tibial tuberosity right here, and the tendon comes from the big thigh muscle here across this bone and attaches right there. This is the patella or the kneecap at that location, and we need to move this bone out in order to move that tendon out and change the angle relationship between it and this bone right here. What we're looking for is the tangent on the curve. It's called the tibial plateau, and so I have a template I put on this to help me determine it. There are a number of procedures for stabilizing the knee of the dog, and the TTA procedure is one of the newer ones. It's considered state-of-the-art, and we've had fantastic success here. So at the end of the day, what I see is I see dogs that have a stable leg when they stand, walk, and run. They have less pain. Actually, right after surgery, they get up and are walking around on their leg like no other surgery that I've seen. And they live with arthritis, but that's manageable with medicine. So we give them a good leg to use, and they go back to having a life of walking, running, jumping, playing. We even had some go back to Frisbee competition. So if you've got a dog that's lame on its back leg off and on, we would love to see your pet, give you a consult at no charge, and make our recommendations, and the TTA might very well be exactly the procedure that your pet needs.